Hi, my name is Paul Neilsen and I'm the head of the Sarcoma Research Group at the University of Adelaide. So at the Sarcoma Research Group, we're focused on trying to identify and characterise new targeted therapies to treat sarcomas. So for those of you that are not familiar with what a sarcoma is it's a cancer of the bone or soft tissue. And unfortunately these sarcomas, especially the bone sarcomas, frequently occur in children. We found that out all too well when my older brother was diagnosed with a Ewing sarcoma, which is one of these rare sarcomas of the bone, at the age of 13. So these poor children that get diagnosed with these sarcomas, they first get put on chemotherapy, followed by surgery and radiotherapy. And the chemotherapy is very brutal. It's 12 months of intensive therapy, and at the end of all of that, if the cancer comes back, usually there's absolutely no treatment options for these sarcoma patients. So having witnessed that and seen my brother go through what he did, and unfortunately he succumbed to the disease at the age of 18, from that moment on I devoted my life and my career to be able to find new treatment options and new therapies for these children with sarcomas. So from there we've been able to establish my own lab at the University of Adelaide, and we're working on new therapies which are looking at engaging the cell death pathways in these sarcoma cells, which is essentially like the self-destruct button for the tumours. So by treating these tumours with these drugs, we're able to stop them in their tracks, and we're seeing some very good results at the moment in the preclinical setting. We hope over the next few decades to be able to really translate these drugs into the clinic, and it's very encouraging already that Australia is taking up some of the leads in some of the clinical trials, the phase 1 clinical trials for these drugs. So in our research we're starting to identify patients and the types of sarcomas, the genetic makeup of the sarcoma, which is really making them sensitive to this type of therapy. And we hope to be able to move into a more personalised cancer medicine era where we can identify the right sarcoma patient for this specific therapy and be able to give patients like my brother, who didn't have an option when the cancer come back, to give the patients some new options and new treatment options. So although I've devoted my career to this, that's as much as I can do, but the research won't go ahead without any support, any financial support. So we can all make a difference by donating, and I'd really like to thank the Cure Cancer Australia Foundation and the benefactors for their generous financial support. Thank you.